Hi everyone, and welcome to today's video. My name is Dakira and I'm a dietitian that helps women to heal from recurring vaginal infections. But I was scrolling on TikTok and I was seeing a lot of TikToks about women who have been dealing with chronic UTIs for years and years and years and have seen no relief. And I also saw that women or being misdiagnosed with these other two conditions that are commonly mistaken as UTIs. So even though my focus is not necessarily on urinary health, it still is a part of the whole vaginal area because UTIs and urinary infections do impact your vaginal well-being and health. So I wanted to make a video on reoccurring UTIs and explaining what UTIs are. We're going to be talking about two other infections that are misdiagnosed as UTIs. And we're also going to be talking about how to begin healing naturally and what kind of help to receive. So, for one, if you've been dealing with burning, urgency, or bladder pressure that never goes away, even when urine tests are negative, then this can be the other two conditions I'm going to be talking about because there are many women who are told that everything looks normal. I've actually seen a girl on TikTok talking about how her doctors were gaslighting her and basically telling her like it's just your anxiety, like you don't have anything. We tested you for UTIs and it's negative. And this is happening to thousands of women everywhere. I see a lot of videos from women from the UK that deal with this. And so when we're normalizing these reoccurring UTI symptoms because doctors are telling us that it's normal, it can actually do more harm than good. So the thing is also is that with these UTI symptoms or urinary infections and symptoms is that they're not always infections, but sometimes it's inflammation, it's nervous system dysregulation, or it's embedded bacteria. So first, we're going to go over what UTIs are. So what a normal UTI is usually bacteria like E. coli that comes from poop that's entering the urethra and the bladder. And antibiotics helps with UTIs short term. It helps for most people because what antibiotics do is it's antibacteria. It's wiping away the bad bacteria. So it helps to alleviate you of the UTI symptoms, but antibiotics sometimes will often also wipe away your good bacteria. That's why when women are dealing with reoccurring UTIs, they may start getting reoccurring yeast infections and BV, and their doctors will automatically prescribe them a diflucan, which is a yeast infection medication with antibiotic to prevent the yeast infection. But repeated use of antibiotics is going to continuously wipe away not just the bad bacteria, but also your good bacteria. In our microbiome, we need both good and bad bacteria to thrive, but we want to have more good bacteria than bad because too much good bacteria can actually be a harmful thing. It can actually cause, vaginally, it can cause what's called cytolytic vaginosis, which is when you have too much good bacteria, too much lactobacilli. So we do need a little bit of that bad bacteria and the good to balance it out. But when we're continuously wiping away our good bacteria, we're decreasing our immunity and we're allowing a lot of bad bacteria to overgrow, and that's what causes the recurring vaginal infections. So, by the way, I'm looking at my notes, but if UTIs keep coming back after antibiotics, this is because it could have formed what's called a biofilm, which is basically a sticky wall around the bacteria that you can kind of imagine would be like a fort for like a war or like something protecting you because it doesn't want to die. So it forms this wall around itself so that nothing can penetrate it and nothing can kill it. So biofilm formation is basically bacteria hiding in layers in your immune system and antibiotics cannot reach. So that's basically what the whole biofilm talk is about. Boric acid, for example, is a natural biofilm disruptor, but that's used vaginally, and that doesn't have to do with UTIs, but I'm just giving an example. So it's really, really, really important that we are restoring our microbiome after each infection and especially during and after antibiotic use. So it's usually recommended to take probiotics, I believe 2 hours, not I believe, but I know 2 hours after your antibiotics so that you are replenishing any good bacteria that was lost. So I do have antibiotics antibiotics, probiotics that I have used on my Amazon storefront down below. So you can go ahead and check that out. But that's basically what a UTI is. So you're going to have that burning sensation when you pee. It may hurt. You may feel like you have to pee and then you don't have to pee. Or you may pee and only a little bit will come out and you'll just feel a lot of discomfort. That's basically what a UTI is. Now, this is another form of a UTI that is often misdiagnosed and not talked about, and it's known as a hidden infection. It's called embedded UTIs. And these are UTIs that are burrowed into your bladder wall and they form biofilms, which release bacteria slowly over time. So these types of UTIs are often missed, or your doctor may not test for it, or they can't because it's hard to detect because on a regular swab, it's coming up negative, but you're still having UTI symptoms. So the symptoms include constant burning, urgency, bladder pressure, low-grade fever, discomfort after sex. And the reason why your urine test, sorry, before I said swab, I didn't mean to say swab, I'm just talking about vaginal infections. But the reason why your urine tests are coming up negative is because standard tests only detect free floating bacteria, not the embedded kind. So antibiotics can often worsen this issue by disrupting your good bacteria and promoting resistance. So then that then leads to antibiotic resistance because these bacteria, it's burrowed into your bladder wall and they form biofilm. So it's not free floating that you would detect in a standard test. So I'm pretty sure with Evie, because I use Evie to heal my recurring vaginal infections, because I was dealing with pH imbalances for 2 years, and then I couldn't figure out what it was, so I did the test with Evie. It showed me that I had a high level of Gardnerella, which is a BV-causing bacteria, and then from that point on, I was able to heal myself in 7 days. But if I'm not mistaken, I'm pretty sure because Evie doesn't do bladder testing, but I think if you do a test with Evie, like a vaginal swab, it can give you clues about the imbalances that's causing the UTI reoccurrence. So I would go to Evie's website and check them out, and you can look at the FAQs and see if it applies also for UTIs. But that can be helpful. Otherwise, obviously, you're going to want to see a urologist that specializes in embedded UTIs and also biofilm formation. And then lastly, we have another condition that is not even an infection at all. So it's not a UTI or an embedded UTI, but it feels like a chronic UTI 24/7. And it's called interstitial cystitis, IC. And it's a chronic bladder inflammation. It's chronic bladder inflammation without infection. So I recently found a dietitian on TikTok. Her name is the Bladder dietitian, and she's the first dietitian I've seen that focuses on some type of vaginal urinary health. So I got excited and I followed her. But she's more focused obviously on bladder, but she focuses specifically on IC, which is interstitial cystitis. And after watching her videos and looking at other people's comments and stuff, this condition basically feels like a UTI 24/7. And not chronic, but common triggers can be stress, spicy foods, caffeine, tight pelvic floor muscles, or long-term antibiotic use. From what I picked up on from her page and other people, is that the main trigger is usually stress. She said that in 90% of her clients, I'm pretty sure, it's because they have a dysregulated nervous system. And when you have a dysregulated nervous system, this can affect your pelvic floor muscles. It can also affect your bladder and your whole entire urinary tract. So your nervous system, first of all, your bladder is deeply connected to the vagus nerve and your fight or flight response. So I'll give you an example. Usually when you get really, really nervous or anxious, you may have to shit. This is because the fight or flight response and our gut is directly connected to the vagus nerve. I said that completely backwards. Either way, what I meant is that our nervous system is connected to our gut and it's connected to our vaginal and urinary tract. So when we get nervous, you may have to pee more often. You may have to shit immediately. But your nervous system plays a really, really big role. And we have the parasympathetic nervous system, and we have the sympathetic nervous system. The sympathetic is a fight or flight response. Parasympathetic is the rest and digest. Our bodies love to heal and rest and digest, but when we're chronically anxious, worried, fearful, stressed, whether that's over relationships or life stressors or finances or just your own stress. What does it matter? This keeps you in fight or flight mode, which keeps your sympathetic nervous system activated, which can then cause you to have these bladder conditions or even also with recurring vaginal infections. I have a whole entire video on my channel about how nervous system dysregulation is directly causing your recurring vaginal infections. So when the brain associates bladder with pain, the body can continue reacting as if there's an infection even when there isn't. This is because it's something called memory body association, I think it's called. But interstitial cystitis is often misdiagnosed as chronic UTI for years. And I have seen women that were going to doctors, getting tested and being told that it was negative and that nothing is wrong, and it's all in their head. And then years later, they found a doctor that tested them for this, and it was just the whole entire time. So, if you're dealing with first of all, if you're dealing with UTIs, just UTIs, and you want to learn how to heal naturally, I do have the 30-day urinary tract healing guide that goes over nutrition advice for you, nervous system regulation, subconscious reprogramming, and other quantum physics, or I guess you can say metaphysic education and tools to help you heal from recurring UTIs. That's down below. So that has everything you need to know. If you are dealing with embedded UTIs, you can also use that ebook for the same thing. My ebook is not tailored towards IC, but my ebook, the knowledge still applies to all these conditions. So you can use it for these things. But the book is mainly it is for urinary tract healing in general. So you can use it for that. But when it comes to, I forgot what I was saying. With these conditions. So with these conditions, you can heal them. You can heal them naturally. You don't need medications. And this is not me telling you not to use medications or to discontinue yours because I'm not a doctor. But you can heal these things naturally. Like I'm telling you guys, follow the Bladder dietitian on TikTok. She healed hers naturally. And she talks a lot about nervous system regulation. And so these conditions, a lot of times women are consistently put on antibiotics and it's only making the symptoms worse. I have another video on my channel about how medications are keeping you stuck in your cycle of recurring vaginal infections. So I'm going to go over some of the root causes of these conditions. So number one, gut dysbiosis. So dysbiosis just means there's an imbalance of your good and bad bacteria. And if you have gut dysbiosis, you have more bad bacteria than good bacteria, or it can be vice versa. Like if you have too much bacteria in your gut, that can also lead to SIBO, which is short intestinal bacterial overgrowth. But gut dysbiosis leads to bladder and vaginal imbalance because there is a connection between our gut microbiome and our vaginal microbiome. I do have another video on that as well, on the gut-vagina connection and how what we eat impacts our vaginal microbiome, but it also does impact your bladder microbiome as well. So when you have dysbiosis in your gut, whether that's from you overeating, too much processed foods like fast food, Wendy's, McDonald's, consuming too much alcohol, you're eating a lot of sugar, you're not drinking enough water, you barely have fruits, vegetables, whole grains, or legumes in your diet, you're constantly relying on coffee. All these things can lead to gut dysbiosis, as well as chronic stress, which is the second root cause of these recurring UTIs or urinary infections, because chronic stress keeps your body in sympathetic mode, which is why I explained earlier, and that's the fight or flight mode, which suppresses your immunity, keeps you in chronic low-grade inflammation, because when we're chronically in fight or flight, our cortisol levels are constantly high. So that in itself causes you to have low-grade inflammation. This can also cause you to hold on to fat in your stomach, which is why people who have insulin resistance hold on to fat in their stomach. It can also cause weight gain as well. It can also lead to prediabetes, PCOS, all these other conditions. And chronic stress also tightens your pelvic floor muscle. A lot of women who deal with or who have had a past of recurring vaginal infections may experience burning or pain during sex, thinking that it's an infection, when in reality, it's the chronic stress tightening their pelvic floor muscle, causing burning sensations during sex. So I do have another YouTube video on that also, on the connection between pelvic floor health and recurring vaginal infections. 3, incomplete healing cycles. So every time antibiotics are used without rebuilding your good microbiome flora, imbalance deepens. So Imagine you're continuously taking antibiotics with no probiotics, like not even a supplement or food. You're continuously wiping away bad bacteria, but you're continuously wiping away good bacteria. And then the good bacteria, sorry, not good, the bad bacteria then starts overtaking your microbiome, and then that's what causes you to stay stuck in the reoccurring cycle of either vaginal infections or urinary infections. 4. Hormonal birth control or menopause. So, hormonal birth control can reduce estrogen, thin your tissues, and lower lactobacilli protection. And so can menopause, because in menopause, your estrogen levels drop, which causes vaginal dryness, and it also lowers your lactobacillus protection. Lactobacillus is the good bacteria that we want high amounts of in order to keep our microbiome balanced. We just don't want too much of it because, like I said, it can cause cytolytic vaginosis. So, how to begin healing naturally. I'm going to give you tips in this video, but if you want more in-depth knowledge that you can carry with you for the rest of your life, the 30-day urinary tract healing guide is literally going to be for you. I spent hours on it. I'm telling you guys, it has so much knowledge that you need to heal from these reoccurring UTIs. And not even just that, you can also use this knowledge with you if you still want to go with Western medicine and go to the doctors and you want to explain to them, or you want to have your own base knowledge so that you don't go there and you're getting gaslit and feeling stupid when you know what you're talking about. My book is going to help you with having the base knowledge of all of that. So, number 1, nutrition. I tell everyone who is dealing with recurring vaginal infections, with any chronic health condition at all, whether it's heart disease, diabetes, PCOS, endometriosis, painful periods, acne, hidradenitis. It does not matter what chronic health condition you have. The 3 things you want to focus on for healing anything is nutrition, nervous system regulation, and subconscious reprogramming. So when it comes to nutrition, this is the foundation of your gut health. So eating an anti-inflammatory diet. You can also choose to do bladder-friendly foods like cranberries, blueberries, any berries at all fruits, leafy greens, garlic, omega-3s. Incorporating these anti-inflammatory foods obviously decreases your inflammation, which will then prevent you from dealing with these reoccurring UTIs or embedded UTIs or the IC. Then we have avoiding bladder irritants. So you can, 1, avoid bladder irritants. 2, you can avoid them temporarily and then reintroduce them back once you feel more regulated. And that's pretty much it. So you can avoid bladder irritants like caffeine, alcohol, citrus, artificial sweeteners. And then eventually, once your nervous system is regulated, you can introduce these things back into your diet, because it's not exactly the food that is causing a direct impact on your bladder. It's your belief behind the food. So if you believe that caffeine causes your bladder to be irritated and you drink caffeine, your subconscious mind has something called the reticular activating system, and its job is to perform confirmation bias. So it's going to confirm this thought and belief to you to be true. So changing your beliefs around foods are going to be really, really helpful for you. You can also try diluted 100% cranberry juice mixed with D-mannose daily. So when I say 100% cranberry juice, I'm not referring to the Ocean Spray sugar-free brand. I'm referring to the glass bottle cranberry juice that you're going to find on a shelf that's usually $6 to $7 and up, because it's 100% pure cranberry juice. This, obviously, we all know cranberries helps with UTIs. Dried cranberries, no, because it is higher in sugar. So if you can use fresh cranberries or the 100% cranberry juice, that can be really helpful. And D-mannose as well can be really, really helpful. I want to explain exactly what D-mannose is so that you guys can understand. But D-mannose is a monosaccharide, which means that monosaccharide is just like the structure of the sugar. Like mono is 1, and then that just, it's biochemistry shit. It's not really important for this. But anyways, it's a monosaccharide naturally found in various plants, fruits, and berries. For instance, it's found in cranberries. And it's known to be synthesized in the body from glucose for the synthesis of glycoproteins. That's stuff that you guys don't really need to know. But either way, it's commonly marketed as a dietary supplement for urinary tract infections. So how it works, which is a good question. I should know this, but whatever. D-mannose is a sugar that's part of normal human metabolism, and the mechanism of action is to prevent bacterial adherence to the uroepithelial cells. So basically, it prevents bacteria from adhering to these cells, which can then cause the UTIs or the embedded UTIs or whatever. So you can get D-mannose powder. Like I told you, my focus is not mainly on urinary health, it's on vaginal health, which is why I had to look that up. But either way, D-mannose, you can use it in a powder form and add it to your cranberry juice. For me personally, when I was drinking cranberry juice all the time, the 100% was really, really strong and tart, and I just couldn't drink that. So I would have a 32-ounce bottle, and I put 8 ounces of the 100% pure cranberry juice in it, and then dilute the rest. Oh my gosh, with water. Sometimes I'll add a teaspoon of ACV, but it's already tart, so you don't have to do that. But that's how you can drink the cranberry juice. You can also get fresh cranberries and incorporate them into recipes. You can get fresh cranberries and simmer them in water and drink that as a tea or water. I actually have a video on my TikTok channel. If you go to my collections, go to bacterial infections, you'll see I have a video on different ways to use cranberries for UTIs. I would check that out. But yeah, when it comes to nutrition, anti-inflammatory foods, bladder-friendly foods, trying to diluted cranberry juice and D-mannose daily can be really, really helpful. But I go way more into depth in the 30-day urinary tract healing guide. Nervous system regulation. This is the most important thing when it comes to dealing with this, because if you are chronically stressed, hypervigilant around your urinary symptoms, around peeing, around holding in your peeing, being scared that you're going to have an infection, you're scared of having an infection after sex, what we focus on grows. So when we're constantly focused on these things, our subconscious mind doesn't know that it's a bad thing, even if it's fueled by fear, worry, stress, or anxiety. All our subconscious mind knows is that whatever we focus on grows, and it has to prove us right. So if you're constantly dysregulated around your vaginal health, on your urinary health, and you're focused on your problem so much, it has no choice but to grow in your reality and to continue. So you want to regulate your nervous system around your urinary health so you can meditate. I just released a UTI healing meditation on my channel. I also do have a subliminal for UTIs. I have a rampage for UTIs. I also do have an IC, interstitial cystitis subliminal, as well as a subliminal for embedded UTIs as well. So you can use these to regulate your nervous system, but specifically the meditation is going to be really, really, really important. And talk more about how to regulate your nervous system in the ebook. But you can meditate, you can journal, and you can practice slow breathing before bed when urgency hits, and teach your body safety, because healing cannot happen in fight or flight mode, which is aka survival mode, which is aka the sympathetic activated mode. So you can practice whenever you feel a symptom, regulate and tell yourself that I am safe. Tell yourself that I am safe even if I held my pee in for a long period of time. I'm safe even if I drank coffee. I'm safe even if I had sex. Just keep telling yourself that you are safe so that your nervous system can eventually register that you are safe and that you're not going to get reinfected. Then we have subconscious reprogramming. This is basically reprogramming your subconscious mind to form new thoughts and beliefs, because our thoughts and beliefs control our reality. 95% of our lives are based on our subconscious thoughts and beliefs. So if you have thoughts and beliefs around, I always get UTIs, I'm stuck with UTIs forever, I always get UTIs after sex, I always get UTIs after holding my pee in for long, I always get UTIs on vacation, I always get UTIs from drinking coffee, like whatever your beliefs are around you having UTIs, your subconscious mind is literally like, oh, okay, this is a reality. I have to keep proving this to her to be correct. So subconscious reprogramming is you literally going into your subconscious mind and rewiring those thoughts and beliefs. The key to subconscious reprogramming is repetition of new thoughts and beliefs. So just as how much you repeated those old limiting thoughts and beliefs, you have to repeat new limiting thoughts and beliefs. And you have to repeat them so much until the old ones die out. That's how you form your neural pathways. So you can use my subliminals, because subliminals are basically audio recordings that have affirmations wired into them that go directly into your subconscious mind. So they bypass your conscious mind. And they're like, imagine a subliminal as like a mental antibiotic. It's like it's going in there, but A mental antibiotic, okay, no, let's say a mental probiotic, because it's going into your subconscious mind and it's literally zapping away all these old negative thoughts and beliefs, and it's replacing them because it's literally flooding your subconscious with thousands of affirmations on a loop. So subliminals are like mental probiotics. They go in there, they build up your good beliefs, they wipe away the bad beliefs. And if our subconscious mind has to prove us right, your body is going to work to prove these new thoughts and beliefs to be true. So you can use my UTI subliminal, my embedded UTI subliminal, or my IC subliminal. You can also use my UTI rampage as well, which is a rampage is you just affirming like in a rampage style. You can use affirmations like my bladder is calm, clean, and healthy. I have a healthy bladder. You can use ChatGPT to come up with some more affirmations for you. You can recite these affirmations 15 times a day. You can write them down, whatever works for you. But I have a whole entire subconscious reprogramming routine that you can follow for 21 days in my ebook that you can help to reprogram your subconscious mind. You can also visualize comfort and relief instead of expecting flare-ups. This is because imagination creates reality, so whatever we imagine and visualize is going to be our reality. That's why the UTI meditation that I have on my channel is a visualization meditation that also uses revision, because visualization creates reality. So in the meditation, you can visualize yourself feeling comfort, having relief instead of expecting flare-ups, because also whatever we assume and whatever we expect is going to be our reality. If you are constantly expecting flare-ups and assuming flare-ups, your subconscious mind is going to prove you right and it's going to cause you to have an infection. So stop expecting flare-ups and start expecting that you are healed. So that works for that. And then, of course, gentle hygiene, always peeing after sex. So if you're having sex, but you're going round after round, you need to pee after every round. If you need help with peeing, drink fluids before and during and after sex so that you can go to the bathroom. So you can drink, obviously, like water with minerals is going to be really, really important, like electrolyte water. Not the ones that have like the added sugar, but just like electrolyte water. You can have diluted cranberry juice with water. You can have okra water. You can have bone broth. You can have water-rich fruits and vegetables. You can have an herbal decaf tea. These are all going to help you stay hydrated and to continuously keep you flushing out any bacteria as you're having sex. Again, stay hydrated. So you should be consuming half your body weight in fluid ounces. If you have any kidney issues and you're on a fluid restriction, obviously adhere to your fluid restriction. But otherwise, the normal human being should be drinking half their body weight in fluid ounces. So if you weigh 100 pounds, you should be drinking around 50 fluid ounces of fluids a day. Again, not just water. It can be from anything that I mentioned before. Also, natural cold pressed juices can count towards your fluid intake as well. And you can use ACV or witch hazel rinses instead of harsh soaps. So ACV rinse is basically just putting a little bit of apple cider vinegar in a cup of warm or lukewarm water and using that to rinse the outside, not internally, the outside. This can also help to balance your vaginal microbiome and your vaginal skin microbiome, because sometimes women have vaginal odor without it being an infection because the skin microbiome, like where the pubic and the vulva area is imbalanced due to either oral sex or using scented products. So you can use ACV rinse just to rinse the outside. I've been using ACV rinses literally since college. I swear by them, because whenever I have an odor and whenever I've had in the past, and I have, and I've used ACV rinse, there's no odor. So it works really, really well. And for witch hazel, you can put witch hazel alcohol free on a cotton swab and just use that to wipe your area, not to wipe your vagina, but to wipe the area. That can also help with balancing your vaginal skin microbiome and eliminating odor. Um, Now, when to get help. So, if your symptoms have lasted more than a few months, not even, if your symptoms have lasted more than like a few days or weeks, find a practitioner who specializes in embedded UTIs or IC. Like I told you guys, for IC, the bladder dietitian, or look for other bladder dietitians. I don't know any other ones. The embedded UTIs, look for a urologist that specializes in this. Otherwise, you can still use my ebook to help you with healing this. And I can still help you also with this in the Vag Reset program, because it's all the same guidance. It's all going to be nutrition, subconscious reprogramming, and nervous system regulation. So you have those tools to help you there. And so At least for me, when I used to work at a job, I have helped women heal from UTIs. But like I said, everything that I teach is in the 30-day urinary tract healing guide. So I hope this gave you the information that you guys needed to help you heal your urinary tract for good. And just know that your symptoms are not random. Do not let doctors gaslight you into thinking that you just have anxiety or that you're fine because the tests are normal. No, if you know something is wrong, keep looking for resources. Well, this video is a resource that just answered all your questions, but keep looking for help no matter what. Use my YouTube subliminals and meditations, get my ebook, and follow me on TikTok also because I do post a lot more on TikTok and also on Threads. I post a lot of information on Threads as well. And just so you know, your body is just being asked for you to pay more attention to it, not medicated again. So a lot of women, they're stuck on medications all the time. And your body does not want medications. It wants you to heal itself naturally, period. And you can 100% heal from these conditions. It doesn't have to be your life. Just because you normalize it does not mean that it has to continue to be normal. You can actually make it abnormal. That's what subconscious reprogramming does. But just know that healing is possible, you can heal, and that you already are healed, period. So that's it for today's video. I try to post every 3 to 4 days, so subscribe to my channel and stay tuned. And ways to work with me or purchase from me are all down below. So bye everyone.